course, that's going to raise a lot of questions for Canada. It seems that the aim of the order, certainly how it was worded last night, had a lot to do with profiteering, with people buying up equipment and trying to send it outside of the United States just to make a profit. That's certainly what the president is talking about in his statement. But what does this concretely mean for Canadians? There was already a lot of concern yesterday before we heard the president speak. Certainly that concern is only growing. And as you mentioned, Justin Trudeau yesterday saying that he thinks that this would certainly be a mistake. Some questioning what he was saying yesterday, even though it was said in a very, let's say, even-tempered tone, whether or not it was to some extent a threat. He said that thousands of nurses go from Windsor, Ontario, for instance, into the Detroit medical system every day, that Americans rely on those nurses. They rely on other things that come from Canada. And as you said, he said making this move would be a mistake, that we know that behind the scenes, government officials are working hard to reach out to their contacts in the United States. They're really leaning on their NAFTA playbook in a lot of ways here, Vashi, trying to influence the president by influencing the people around him. Every level of government, from certainly what we saw during NAFTA, from governors to the people in the White House who are around Donald Trump, hoping that is going to work. And you've got to think that depending on how things play out here, the stakes could be higher, really, than we've ever seen before.
Yeah, and it's interesting that you bring up the stakes, because I've been trying to figure out and ascertain, okay, if, for example, 3M decides they can no longer, or because of the order, they can't ship masks, those N95 masks, and we should qualify. Those are the masks that doctors and nurses use. They're N95 masks because they keep out 95% of the particles in the air. So they're very important, especially where the spread of this pandemic is concerned. But when I try to find out, okay, how many masks do we lose as a country? How big of a portion is the supply of 3M masks in the overall supply of masks in this country? I have yet to be able to get a very specific answer. The minister I had on last night just used the word significant. I have been able to find out that I guess 3M is one of only 2 companies in the United States that end-to-end manufactures these masks. So they're obviously a significant supply in the U.S. as well. It could, like you say, though, have a really detrimental effect on the supply of PPE in this country, a subject we've been talking about all week.
A couple of things I think we can dig into there. 3M in the United States talks about masks for Canada and Latin America as being the ones that they're exporting right now. We should note that the CEO of the U.S. company says on humanitarian grounds, he thinks he needs to keep exporting these masks because he says in those countries we are the primary supplier. Now, as you rightly point out, does that apply to Canada? Is 3M the primary supplier of those N95 masks for this country? Canadian officials not willing to talk about that. And we can, I think, to some extent understand why when we look at the global picture of what's going on right now in terms of securing personal protective equipment. The phrase that keeps being used over and over again in a variety of scenarios is this idea that it is something of a Wild West. There's a lot of focus on the United States today, but we should say that there are actually dozens of countries around the world who have taken measures to restrict to at least some extent the export of this kind of equipment. There are all kinds of wild stories of shiploads of masks being bought right off the tarmac, destined for one country, headed to another. In terms of the picture in this country right now, some of the things that we do know, Quebec, for instance, the premier saying just yesterday that his province has about 8 days' supplies worth of personal protective equipment. We know that that's a province that has been particularly struggling in this regard. We also know that there's a national stockpile and that the provinces that are most in need, according to what seems to be consensus from all of the premiers and the prime minister, that the provinces that are most in need are the ones that will have access first. But we also know that behind the scenes, things are moving fast and furious. We heard Ontario Premier Doug Ford yesterday echoing, frankly, something the Prime Minister has also said, which is let's build up the domestic capacity. But obviously that is not going to happen overnight. One other note, Vashi, was interesting to hear from BC last night, pointing out that the raw materials to make those masks, well, some of them come from BC. And so this raises this question of retaliation. Is that going to be the way that Canada handles this? Certainly the Prime Minister is going to face questions about that today.
He sure is. Thanks so much, Catherine. And our viewers can see, we'll check back in with you shortly, I'm sure, but our viewers can see the shot up there. We are awaiting the Prime Minister's comments on this issue, and also an announcement around money that has already been announced for shelters and more vulnerable Canadians during this pandemic. We'll find out exactly where that money is expected to go. But for more on the situation with those N95 masks, I want to bring in one of our Washington correspondents, Stephen D'Souza. Hey, Stephen. Help us understand a little bit about why the president is doing this. I read last evening something like the U.S. needs about 3.5 billion N95 masks to get through this pandemic. That's what the Department of Health and Human Services estimated. Give us and our viewers a bit of a background on why the president would have invoked an order like this.
Well, it's interesting because, the president is facing a lot of backlash domestically from states who are saying that they're simply not getting enough of the supplies that they need from the federal government, and that the federal government isn't doing a good enough job coordinating distribution from the national stockpile. And that caused some controversy earlier this week when Jared Kushner, the president's son-in-law, who has been involved with the coronavirus task force headed by the vice president, made an appearance at the daily briefing and said that this national stockpile is ours. It shouldn't be for the states, when in fact really what it is for the federal government to distribute to the states. And there was some controversy because the federal stockpile website, which in fact gave that very description that it should be distributed to the states, changed its wording the next day, even though officials say that that change had been in the works for quite some time. And so the president is facing a lot of pressure domestically from states saying that they're simply not getting enough supplies. And so, as Catherine mentioned earlier, the president has invoked the Defense Production Act, mainly targeting what he said was intermediaries, brokers, distributors, who he described as wartime profiteers who are inflating the prices for supplies like N95 masks as well as surgical masks. But also the other issue too is just the overall sort of marketplace for this, which Catherine mentioned as well, that states are complaining that when they go to companies, when they go to distributors to bid for these supplies, these personal protective equipment supplies, they're getting outbid by the federal government, and so prices are getting driven up by the federal government. There's no real coordination. And then on the international market as well, Catherine mentioned, there are these stories of international intrigue. Germany, for example, accusing the U.S. Of stealing 200,000 surgical masks that were destined from China right off the tarmac, even though 3M says that it's not clear that there was ever such a shipment. France and Brazil saying that they're getting outbid on the international marketplace by the U.S. So, as Catherine said, the term Wild West is being thrown out there, that it really is an international marketplace where there are scarce resources and countries are bidding against each other, sometimes bidding within the country, and it's just not clear, who's coordinating things and who the supplies are getting to. But when you hear from frontline workers, they're saying at the end of the day, it's not reaching them. Some states are saying that even the stuff that they're getting from the national stockpile in the U.S. is coming that's out of date, where the expiration date was 10 years ago, or it's afflicted by dry rot and simply not usable. So a lot of issues that the president is dealing with domestically that's impacting his decision, that's having a ripple effect on countries like Canada.
Yeah, and potentially a lot of effect on Canadians here. Thanks so much, Stephen. We'll check back in with you a bit later. The CBC's Stephen D'Souza. We are awaiting comments from the Prime Minister on the issue that we've been discussing, the President's order to stop exporting N95 masks to Canada. Let's get some more analysis on that. Scotty Greenwood is the CEO of the Canadian American Business Council. She's also a former American diplomat in Canada. She joins us now from Washington. Hi, Scotty. Nice to see you.
Hi, Vashi. Nice to see you, too. Thanks for having me.
Let me ask you flat out, is there any chance the president changes his mind on this?
Absolutely. The president changes his mind a lot on many things. So, yes, we saw this, Vashi, during in a different situation, much less dire. But we saw during the negotiations of the new North American Free Trade Agreement, the president would make these statements. The administration would try to scramble to keep up. But in the end, we got to a better agreement, and he had to walk back a lot of the things he said. So this is a time when manufacturers and governments need to work together to solve the problems and meet the needs. And I think it's not a great dynamic between the president and 3M right now.
You were well acquainted with the Team Canada approach during NAFTA negotiations. We understand that something similar is in the works right now. Your advice to government officials, or what do you think might work in order to try and get the president to change his mind?
Well, look, the Team Canada approach that's been in place over the last year and a half for the trade negotiations proved to be very successful. So the Trudeau government, the opposition, the provinces, mayors stakeholders all pulled together and reminded the United States why it's in our interests to work together with Canada and with Mexico. So, there's a mill in British Columbia. You may have reported on it earlier, the Harmac mill in Nanaimo, that has the particular kind of pulp that's needed in a lot of this personal protective equipment. So we really need each other, and we can't really unscramble this egg of economic integration, and we shouldn't try. I mean, it's one thing to increase your domestic capability. Everybody understands that, and I think is working on that. But it's another thing for people or countries or communities to try to hoard, and that's what we really need to work against.
What about sort of the domestic side of all of this? I mean, I consume as much, news from south of the border as anyone else in Canada. And what we can see is there's a real discrepancy in the ability to meet the needs of various states. You hear one governor say, I've got enough. You hear another governor say, no way. I mean, we see that to a lesser extent here in Canada as well. But what kind of domestic pressure is the president under to try and meet the PPE supply needs of states that are particularly suffering from the spread of this virus?
Right. Well, this situation really calls for a very coordinated approach on the industrial response, right? So the Defense Production Act, which came around in the 1950s and the president has referred to, I think is not meant to be a one-off reaction for one company or one community or one state. So I think what's needed, and I think we'll get there, I hope we get there, is a real coordinated approach where governors and the president, the administration are talking to each other, like in Canada, the prime minister talks to premiers and tries to coordinate. So I think we're going to need to see more of that here, so that it's not reactionary and it's not pitting one community against another, but it's figuring out how we can all help those who need it most.
Okay, I'll leave it there. Thanks a lot, Scotty. Really appreciate your time today. Good to see you.
Good to see you, Bashi.
It's Mary Scott Greenwood in Washington. I'll swing back over to Catherine Cullen. We're about 2 minutes out, Catherine, from the Prime Minister addressing Canadians. One other thing I just want to touch on with you before he steps out those doors. Another series of questions he's received a lot this week that kind of jumps off what we saw from the Premier in Ontario yesterday, and that is around modeling, sort of forecasting, presenting various scenarios to Canadians. What do you expect from the Prime Minister there today?
Well, I mean, I think we can expect that he's going to continue to be pushed to release that information, release the national models. It is something he has said that he is willing to do. His officials and he have talked about concerns about aligning essentially all the data from across Canada in order to be able to provide the most accurate possible model, I suppose. At the same time, he and his officials are looking at information right now, and a lot of Canadians are wondering about that, specifically bouncing off what we heard yesterday. I think one of the big questions that comes out of Ontario's projections has to do with the time frame we're talking about here, Bashi. Ontario talking about, a second wave, even the possibility of a tertiary, a third wave, and an 18-month to 2-year time span overall as we look at things sort of go up and down. And so I think questions for the federal government, mostly we've heard the Prime Minister talk about issues in terms of weeks, perhaps even months. When we start to talk about a broader scenario that could play out over the course of years, or a couple of years at least, I think there are questions for the Prime Minister in terms of what he is seeing on that front. And again, just when is that national data going to be ready for him to talk to Canadians about?
And he has always, over the past week, Catherine, sort of answered those questions with the caveat that our behaviors now really will determine, what that projection ends up confirming rather than sort of the various scenarios. But I think you're absolutely right that the big headline for me yesterday out of Premier Ford's press conference, and prior to that, the public health officials in Ontario, was this projected timeline of 18 to 24 months. And it's very different from other timelines that even sort of rhetorically we've heard from the Prime Minister when he says it's weeks or months maybe. We're not hearing years, certainly, at this point. And you have to wonder if that, if they are getting information that shows perhaps we might have to be undertaking these kinds of social distancing and physical distancing measures for more than a few months.
Well, certainly we know, even from what we've heard from public health officials, I mean, I believe it was Dr. Theresa Tam was the first one who federally raised the idea of a second wave. So there are conversations going on behind the scenes that would, we can only imagine, but it seems self-evident, would involve discussions about a second wave, maybe even a third wave. What does that look like? part of this has to do with something else. We can see the Prime Minister coming out right now, but his government has talked about the need for radical honesty. We're waiting for those answers.
Let's listen into the questions and the answers. Here's the Prime Minister.
You're worried about your job or your business. You're concerned about your health or the health of an elderly parent. No matter what this has meant for you, I know you're looking for answers. Knowing where we are now and where we might be in the coming weeks and months is how we can all figure out our response. For you, that could be planning on how to make sure the kids keep learning even though they're at home. For our government, the numbers and data compiled by our experts are critical to understanding the scope of this pandemic and informing the decisions we make to keep you safe. And we've made sure you can access the most reliable, accurate information available to us at canada.ca/coronavirus. We're going to keep releasing up-to-date data on a daily basis and using it to inform our decisions. And we'll continue working with the provinces and territories on getting new information to have a complete national picture that we'll share with you. Regardless of the varying models or predictions, one thing is consistently clear. The measures that have been put in place by all orders of government, from closing schools to staying home, are saving lives. But this will only keep working if everyone continues to do their part. If everyone takes their duty to nurses and doctors, to the elderly and to the vulnerable, seriously. As seriously as if it were the life of their parent or their child on the line. Because it is. The cashier at the store is someone's brother. The paramedic saving lives is someone's wife. That's what's at stake here. The lives of the people we love, the lives of the people our neighbors love. So do your part. Wash your hands, stay 2 meters away from each other, and above all, stay home. Ça fait plusieurs semaines maintenant
For a number
que
of
nous
weeks
restons à la
now,
maison.
we have been staying
C'est ce qu'il
home.
faut faire.
That's what
En
we
plus
need
de
to
garder
do,
nos distances
in addition
et se
to
laver les
keeping
mains.
our distance and washing
En
our
fait,
hands.
c'est à la
In
maison
fact,
que la
it's at
plupart
home
d'entre nous
that
se
most of
sentent le
us
plus en sécurité
feel the
en ce
safest
moment.
right at this time.
Mais imaginez
But
si
just
vous aviez
imagine
plus peur de rester
if
chez
you
vous
were more afraid to stay
d'affronter la
home
pandémie.
than to confront the
Malheureusement, c'est la
pandemic.
réalité
Unfortunately,
pour beaucoup
that
trop
is the
Canadiens.
reality for too
C'est
many
le
Canadians.
quotidien.
It is their
Les
daily
femmes qui sont victimes de
experience.
violence.
Women who are fleeing violence.
mère
No
ne
mother
devrait avoir à
should
choisir
have to
entre
choose
garder ses
between
enfants dans une
keeping
maison où
her
ils sont en
children
danger
in a house where
et
they're
les
not
emmener
safe
dans un endroit
or
où ils
taking
pourraient
them
tomber
to a
malades.
place where they could fall
On a donc
sick.
investi
We
40
therefore
millions de
invested
dollars
$40
dans les
million
refuges pour femmes et
in
les
shelters
centres qui viennent
for
en aide aux
women
victimes
and
d'agressions sexuelles.
centers
Et
that
pour les
help
femmes et
women
les enfants
facing
autochtones
violence.
qui fuient la
For
violence,
women and
on a
indigenous
investi
women and
10
children,
millions de
we
dollars
have
dans les
invested
refuges
$10 million
d'urgence.
in emergency
Ces fonds
shelters.
aideront les
This
refuges
money
pour
will
femmes à
help
prendre toutes
women's
les mesures
shelters to take
nécessaires
all the
pour
necessary
protéger les
measures
gens non
to
seulement contre la
protect
violence,
the people
mais
against
aussi contre
violence, but
la
also
COVID-19.
against COVID-19.
Pour aider les sans-abri,
To help
on a
the
augmenté de
homeless,
plus de
we
157
increased by more than
millions de dollars
$157 million
le financement destiné au
the
programme
funding
Vers un
of
chez soi.
the
Les
program
responsables du
to help the
programme pourront
homeless.
donc acheter des choses comme des autres
People
lits
will be able to
ou
buy
louer des
additional
nouveaux locaux
beds
pour que les gens
or
dorment pas trop près
hire
les uns des
or
autres.
rent
On
new
envoie de l'argent aux
facilities
communautés qui en
to
ont
house
besoin,
them.
de Vancouver à
And
Saskatoon,
we
de
know that
Toronto
there
à
are
Halifax.
centers like this
C'est pas juste une
in all
question
the major
d'offrir aux
cities.
gens
It's
un endroit
not just
sûr où aller
about
pour
helping
échapper à la
people a
violence
safe place
ou
to
pour éviter
escape
de dormir dans
violence
la rue.
or to avoid sleeping in
faut
the street.
protéger
We must
tous les membres
protect
de notre
all
société
members
contre
of
la
our
COVID-19.
society against
Ça inclut
COVID-19,
les plus
and that
vulnérables.
includes the most vulnerable.
No one should have to choose between being somewhere they're unsafe and risking getting COVID-19. That's why we've invested $40 million for women's shelters and sexual assault centers across the country. And for Indigenous women and children fleeing violence, we're providing $10 million for emergency shelters. For other shelters, we've boosted funding for the Reaching Home program by over $157 million. This will help buy things like physical barriers or rent new space to keep people safe. The communities that need this funding have now been identified, and money is getting to them. For people from Victoria to Hamilton and Regina to St. John's, help has arrived. I know we're asking a lot right now. To stay home, to not see friends, to close your business temporarily. It's not easy. I get that. But these sacrifices are necessary. The price of acting otherwise is just too steep. To those who are sick right now or have family in hospital, in the ICU, to those who've lost a loved one or a friend, we're thinking of you, we're here for you, and you remind us of what's on the line. We all need to take physical distancing very seriously. Done right, these measures will save lives and bridge us, slowly but surely, back to normal. At the same time, we're working around the clock to get Canada the resources we need. In the next 48 hours, we will be receiving a shipment of millions of masks by a chartered cargo flight. We're also working with provinces to transport their medical supplies when possible. Items ordered by Quebec will be on this flight. Our government has also leased a warehouse in China to help collect and distribute these items as quickly as possible. And going forward, the flights we're chartering to get the materials here include Canadian companies Cargojet and Air Canada. I want to take a moment to thank everyone, whether you're working in a warehouse, flying the plane, or part of the ground crew, for your dedication.
Looks like we have a bit of a technical difficulty there. I'll just recap until we get things fixed, what the Prime Minister is saying. Oh, I hear him now. Never mind. We'll swing back there.
We're doing everything we can to support you while you do your part. So this weekend, stay at home. Protect your loved ones and our frontline workers. Save lives. I want to take a moment to talk to kids again today. Even at home, there's lots of stuff going on. There's lots of stuff to do. I'll be holding a video conference tomorrow with Dr. Tam to talk through some of your questions. I know a lot of you have sent them in, and I look forward to seeing you tomorrow. Tomorrow, you'll also have a chance to ask someone who knows better than anyone else about staying inside, an astronaut. Canadian astronaut Jeremy Hansen will be live on YouTube tomorrow to talk with you. So ask your parents to help send in a question ahead of time. Aux enfants, je sais que vous avez beaucoup de
To the
questions.
kids out there, I know you have a lot of questions. So tomorrow, you can listen to our video conference with Dr. Tam, where I will be answering your questions. And don't forget that the Canadian astronaut Jeremy Hansen will be online on YouTube tomorrow. In order to protect your wages and the economy, we developed a three-point plan, which will allow us to protect jobs, support small and medium-sized businesses, and help those who have lost their paycheck. To protect your health and the health of all our essential workers, we are working with many different companies to manufacture and distribute medical equipment and PPE. We will help you. We will help you to come through the storm. But we need you to do your share. I know that I can rely on you to do that. This weekend, stay home and save our frontline workers. Save lives. Thank you.
Thank you, Prime Minister. We'll now take some questions from the phone. As a reminder, one question, one follow-up. Over to you, operator.
Thank you. Merci. The first question is from Teresa Wright from the Canadian Press. Your line is open. Votre ligne est ouverte.
Good morning, Prime Minister. Yesterday, in response to questions about the White House order for the U.S. to stop exporting N95 masks, you mentioned the thousands of nurses in Windsor that go across the bridge to Detroit every day. Is Canada considering stopping those nurses from going to the U.S. as a retaliatory measure?
No, we recognize that our countries are deeply interlinked in sometimes very complex ways. The necessary goods and services that flow back and forth across our border keep us both safe and help us on both sides of the border. We are continuing to engage in constructive discussions with different levels within the administration to highlight that the U.S. will be hurting itself as much as Canada will be hurting if we see an interruption of essential goods and services flow back and forth across the border. We continue to demonstrate that this is a good thing for both of our countries, and we look to continue to ensure that essential supplies get across the border.
How concerned are you that those arguments, that case that you're trying to make, could be falling on deaf ears?
We've had extremely constructive conversations with the Americans over the past weeks throughout this crisis, and we continue to get very good response from them on this issue as well.
Thank you, Teresa. Next question, operator.
Thank you. Merci. The next question is from Rod Nickel from Reuters News. Their line is open. Votre parole est à vous.
Prime Minister, Premier Kenney said yesterday that his government will take part in next week's OPEC Plus conference call. Will your government participate in that conference call whenever it happens? And what specific outcome in terms of global supply cuts is your government looking for?
As you know, that conference call, that meeting for Monday has been canceled. We're continuing to engage with our partners and look very carefully at how we can ensure that Canada's perspective and Canada's voice is heard during these important deliberations.
And just as a follow-up, to what extent is your government holding off on finalizing its oil support package pending these global talks about supply cuts?
No, we are continuing to work forward regardless of what happens in the global context on support for oil and gas workers who are suffering. But that is why at the same time we move forward early on in direct support for workers across the country in all industries. The wage subsidy and the CERB will be there to support Canadians who've fallen onto difficult times because of COVID-19.
We recognize that we have to ensure that we can help workers in those industries that have been deeply affected, such as the oil and gas sector, and we will continue to look at how we can do that in the next little while. At the same time, I want to say that the measures we have put forward, whether it's the wage subsidy or the Canada Emergency Response Benefit, will help people in all those industries right across the country who have fallen on hard times because of COVID-19.
Next question, operator.
Thank you. Merci. The next question is from Catherine Lévesque, La Presse Canadienne. Your line is open. La parole est à vous.
Good morning, Mr. Trudeau. I'd just like to come back to what you said about the masks that will be coming to Canada soon. You said that includes the ones ordered by Quebec. Are those from 3M or where are they from? These are masks that are coming from China. We are currently working to ensure that the supply chain between China and Canada continues to operate, and that is the order I referred to. Thank you. And coming back to Mr. Trump, I wondered, did you call him or do you intend to call President Trump? And is there any other way, perhaps use the new NAFTA, that we could do something about the masks? Well, since the crisis began, I've been speaking regularly with the U.S. President, and I intend to speak to him again very soon. But for the time being, the discussions are being held at various levels of the administration, and we're pointing out to them that essential goods and services flow across the border on both sides. We have nurses who work on the other side of the border, and in terms of gloves and other types of equipment and test kits, the fact is we supply that equipment to the United States. Our our economies are so interconnected that it would really hurt both countries to block that supply chain.
I will be speaking to President Trump in the coming days. I have spoken with him a number of times over the past weeks since the virus really started to hit hard. We're continuing to engage at all levels with the administration, having very constructive conversations, highlighting that the flow of goods and services that are essential to both of our countries flow both ways across the borders, from medical professionals right across the country who live in Canada and work in the United States, to essential goods from gloves to testing kits that Canada ships to the United States. It is in both of our interests to maintain this extraordinary close relationship.
Thank you, and we'll take one more question on the phone, operator.
Thank you. Merci. We have a question from Michel Lamarche, TVA. Your line is now open. La parole est à vous.
Bonjour, Monsieur Trudeau.
Good morning, Mr. Trudeau. I'd like to know whether you have spoken to the Americans in your recent discussions about the fact that pulp and paper used to produce those N95 masks comes mainly from Canada and Nanaimo, BC. Have you talked to them about that? Have you reflected on that with them? Yes, we have pointed out to the U.S. all the different materials and services that flow back and forth across the border. We do not want to start limiting our exports or the services that we provide to the United States. We understand that both of our countries will be much better off if we continue to count on each other. And I'm confident that we will be able to find a solution to this situation.
We have highlighted in many different ways the very many different products and resources that flow across the border in both directions to ensure success for our economies, success in keeping our citizens safe. We are not looking at retaliatory measures or measures that are punitive. We know that it is in both of our interests to continue to work collaboratively and cooperatively to keep our citizens safe, and that's very much the tenor of our conversations, and I'm confident that we're going to get there.
Monsieur Trudeau,
Mr. Trudeau, we are now aware of the Ontario scenarios. I imagine you saw them yesterday. I'd like to know how you reacted, and do they resemble the scenarios for Canada as a whole, and when will you be releasing them? Yes, we saw the Ontario scenarios. We're waiting for the ones from Quebec, which will be available in a few days, and we are constantly working with the provinces and territories to get the correct data and the right information to be able to prepare proper projections for Canadians and answer the questions that everyone has. How serious will this become? When will we be able to cut back on some of the measures currently in place? But I just want to say that every model, every prediction, every projection is based on the fact that we must stay home, we must limit our movements, we must keep a 2-meter distance from others, we must continue to wash our hands. This behavior will help Canadians, and it will ensure that whatever model we're talking about, we will get the best possible results, and there will be the least amount of damage and the fewest deaths possible. Now, there will be more modeling and data released in the next few days, but in the meantime, it's important for Canadians to look at what the numbers are, and we're waiting for numbers from the province for that to happen.
People want to know how bad this is going to get, how much longer it's going to last. We saw modeling and predictions from Ontario yesterday. We know we're getting more modeling and predictions from Quebec in the coming days. Canada, at the federal level, will continue to pull together the information and make models and predictions based on that. But regardless of the curves and the models put forward, one thing is consistent throughout all those predictions, that the more people stay self-isolated, stay at home, keep that 2 meters of distance from each other, don't go out unless absolutely necessary, and wash their hands regularly, the better off we'll be. We will be continuing to share up-to-the-minute data on canada.ca/coronavirus. Please go check it out, see all the public data, the data that we're making public from all across the provinces, and we will continue to build and share our predictions in the coming days on how Canada is going to be doing as a whole.
Hi, Prime Minister. Mackenzie Gray with CTV. Kind of following up on the previous question, yesterday when the Ontario government put out their projections, they said that between 3,000 and 15,000 Ontarians potentially could die from COVID-19, that we could be in this from 18 to 2 years, and that potentially could be 3 waves of this. You've seen the projections that Dr. Tam and Public Health have put forward. Are the models that Ontario put forward consistent with what you've seen so far?
From the very beginning, we've seen a range of models talking about the coming weeks and months to much longer than that, talking about very high numbers of possible deaths to talking about very low numbers of possible deaths. We know the situation is serious. We know there are a range of possibilities, and every given model will just give those range of possibilities. What actually happens depends on the choices and the actions that we take every single day. That's why, regardless of the model that is put out there, we can impact that model, we can change the predictions based on how we act. Staying home, keeping 2 meters distant, and washing your hands.
Dr. Donnelly referenced yesterday that Ontario was be able to make predictions on the mortality rate largely because we're able to look at international data that we've been able to collect so far on mortality rate. If that's the case and Ontario's been able to put out projection, other provinces are going to do so, why can the federal government not confidently put out a number right now?
Well, we recognize that different countries around the world face very different mortality rates, very different situations depending on their local circumstances. The same way in Canada, the way different provinces are experiencing, are handling, are bringing in measures to adjust to their situations vary as well. And at the federal level, we depend on collating, collecting, and aligning all that data from the provinces in order to build a better picture of what's going to happen across the country. We've seen different provinces put out numbers, put out data, put out models, but before we can get to a proper national model, we need to have an even better idea of what we're doing in various provinces. Nous reconnaissons que différentes provinces ont différentes circonstances, comme on voit des pays à travers le monde dans des situations extrêmement différentes, dépendamment de ce qu'ils sont en train de vivre. C'est pour ça qu'au niveau fédéral, pour rassembler
when it comes to developing an idea of what Canada is going to be facing across the country and developing projections, we have to use models and data and projections from the provinces. That's what we're doing now. We are collating all of that data and aligning that data so that we can share that with you in the coming days and give you a vision of what Canada can expect.
Last night, President Trump made it very clear that he's unmoved by your urgings and that he will go ahead with this ban on exports. So what is the number, what is the impact that this has on Canada's medical supplies?
As we've said, we have been working day and night to source medical supplies for Canadian frontline workers. We have shipments coming in the next 24 hours. We've received shipments over the past days. We continue to work with suppliers around the world to ensure that we do get the medical equipment that we need, and we have more coming in regularly. At the same time, we're working with the American administration to ensure that they understand that goods and services that are essential to both our countries flow in both directions across the border, and it is not in any of our interests to actually limit that flow. We are also, of course, turning towards Canadian manufacturers as the tremendous effort that Canadian companies are putting in to develop made in Canada products, PPE, equipment, and medical supplies that is going to actually not just supply Canada, but be there to supply other countries who need them as we meet our own needs. This is part of what Canada is doing to ensure that we are protecting our frontline workers and all Canadians every single day.
Sorry, go ahead.
Okay. Nous allons continuer de travailler pour amener les produits essentiels à travers le monde.
Essential goods in from around the world. We will continue to work with the U.S. administration and point out to them that it is in the interests of both our countries to ensure that we have the essential goods and services we require on both sides of the border, and we will continue to work with industries across Canada to develop Canada-made solutions to keep all our workers safe.
An answer on how much the impact is. Mean you don't have the numbers, or does it mean you're not willing to share it? And given that the EU has also done this several weeks ago now, why isn't Canada doing the same?
We understand that it is really important to keep global supply chains flowing. We know that Canadian frontline workers are depending on the arrival of PPE from around the world, and that's why we are facilitating those arrivals. They've arrived last week. We've got more coming in the coming days. We will continue to work to ensure that that comes in. We're also continuing to impress upon countries around the world that they are hurting themselves when they limit the flow of essential goods across their borders. We need to work together to make it through this global pandemic. That is what Canada will always do.
Brian Mullen, Global News. A question about testing. Why didn't Canada start procuring tests earlier when we saw what was happening in China? Are you concerned with the limited amount of testing means that you don't have an accurate picture of what's going on to inform policy, especially the potential role of asymptomatic people silently infecting other Canadians, which more testing would have identified?
Canada has been doing an awful lot of testing. We have been ramping up testing. We've certainly done more testing than a lot of other countries like the United States. And we've seen that early and strong testing in places like Alberta and BC have been very, very effective at managing and controlling the spread of COVID-19. We recognize that mass testing and accurate rapid results are a key part of managing the virus going forward, of ensuring that we continue to be safe through the coming months, and that's why we are increasing our testing capacity every single day.
We recognize that test kits are absolutely critical in order to manage the spread of the virus. And of course, we are doing well in terms of testing in Canada, but we can always do more. And that's one of the reasons why we are constantly increasing our testing capacity. In British Columbia and in Alberta, for example, the testing kits have been very effective, and the testing in general have been effective in controlling the spread of the virus. We know that we have to do more across the country, and that's why every day we are increasing our screening capacity.
CBC News. Are you concerned that the battle we're seeing over face masks, such as the one we're seeing now with 3M, could extend to other medical supplies and medications to treat COVID-19? Could this just be the tip of the iceberg, and what are you planning to do about it?
That is one of the reasons why we have turned towards Canada's local industrial capacity to develop these solutions for the coming weeks. We know that Made in Canada solutions are on their way because thousands of businesses, of manufacturers across this country are stepping up, are switching their assembly lines and supply lines over towards producing the necessary medical supplies and equipment that we need. In the meantime, we will continue to source these products from suppliers around the world. Shipments are coming in over the next 48 hours. We've had shipments come in over the past few days. We're going to continue to do everything we can to ensure that our frontline workers get the support and the protection they need.
But do you have concerns that these shipments could be in jeopardy?
Okay. We know that there is a global competition for these products. Every country in the world needs more of them. That's why Canada is shifting over so much of its industrial production to develop these masks, these solutions, these equipment, so that we can cover our own needs over the medium and long term, and be there to help other countries at a point where we have enough for ourselves as we manage the spread of COVID-19. At the same time, in the short term, we're continuing to procure the necessary equipment that our women and men on the front lines need right now. We know
that there is a global competition out there in terms of trying to secure masks, and that's why we are now trying to develop our domestic capacity to produce this equipment, this critical equipment, to protect our frontline workers. This is a solution that will be in place in the medium term, and in the short term, we will be receiving shipments of material from around the world, which we need to keep our citizens safe. Radio-Canada, you spoke to Mr. Trump about NAFTA and about the masks. With respect to NAFTA, would there be a point in waiting to implement it, as some industry groups are asking, because of a global pandemic? Do you think it would be a good idea to postpone it, or do you want it to be implemented right away? And in terms of masks, what exactly are you going to say to him? How can you negotiate with him on this? Well, with respect to NAFTA, we understand that the process of harmonizing regulations will take a certain amount of time and work. There are people in the government working on this now, but of course we have a lot on our plate right now in responding to COVID-19. But I can assure people that the new NAFTA agreement will come into force very soon. NAFTA, the current NAFTA, in the meantime, remains in effect and will guarantee free trade with the United States. So we will be coordinating this effort with the U.S. and Mexico, but our priority right now is to continue to do everything we can to protect Canadians and fight COVID-19. In terms of my conversation with the President, I pointed out to him that there are healthcare workers in Canada who work along the border and on whom they depend. And there are also a great many products that are essential for the United States in fighting COVID-19, and I know that this will be a very constructive discussion, as we always have and always have had.
We will continue to work very, very hard to remind the Americans, as I will in my conversation with President Trump when it happens in the coming days, that we are, both of us, interlinked in ways that means that it would hurt both of our countries in our ability to protect our citizens were supply chains to be disrupted. There are Canadian health professionals right along the border with the United States who engage in supporting American medical systems in a daily basis, and that would be something that is valuable to the United States. It's also extremely valuable that we are part of essential supply chains for things from testing kits to gloves to the ingredients in N95 masks. We know that we do better when we work together, and that'll be my message to the President.
Are you open to postponing the implementation of the agreement? Well, we will be working with the Americans and Mexicans to see when the new NAFTA should come into effect, but this is something that we will continue to work on, but our priority right now is COVID-19.
With Mexico and the United States on the ratification of the new NAFTA, but as a reminder for everyone, the existing NAFTA is still very much in place and will remain in place until such a time as the new one is brought in. The people who are working, who usually work very, very hard on ratification of trade deals, like most people in government, are very much focused on our response to COVID-19, and that needs to be our priority right now. Merci beaucoup tout le monde. Merci tout le monde.
That's Prime Minister Justin Trudeau in his daily address, making a couple of significant comments. I want to begin just by highlighting the salient points in the announcement, the initial announcement that he made, because it has to do with a lot of vulnerable Canadians, particularly women in this country who are facing violence. The money, the original money announced to combat those issues came last week, but now we find out exactly where it's going. So $40 million for women's shelters and sexual assault centers across the country, $10 million for Indigenous women and children fleeing violence, and then for other shelters to boost things like renting additional spaces or physical barriers, an additional $157 million. Now, the substance, the majority of the questions that the Prime Minister got centered on two issues. The first being that order from President Donald Trump, U.S. President Donald Trump, to 3M to stop exporting, to stop sending N95 masks, crucial masks for healthcare workers in this country, to Canada. The Prime Minister said that he'll be speaking with President Trump in the coming days, so that conversation has not yet taken place, but that in those conversations, or in that conversation, he would highlight the interdependence of the relationship between the United States and Canada. The other main question that the Prime Minister got centered around modeling. We saw yesterday Premier Doug Ford and public health officials in Ontario release various scenarios for how this pandemic might play out in Ontario. The Prime Minister has been asked repeatedly this week, when will that national picture be presented to Canadians, the various scenarios that as a country we might face? And the Prime Minister said that that will come in the coming days. I want to bring in my colleague Catherine Cullen, who is listening alongside myself to all the comments from the Prime Minister. I'll start on the modeling picture, if you don't mind, Catherine, with you, because it sounds like they're waiting on just Ontario and Quebec. They have the numbers now from Ontario. They have to integrate them. Quebec is supposed to come next week, but it does sound like we will get those scenarios sooner than later.
And in fact, the Prime Minister did say the other day soon, so the big question has been, what does soon look like? And as you rightly point out, Vashi, talking about it perhaps being contingent on those two provinces. I noticed one of the questions the Prime Minister was asked about that. He said there are a range of models. Some of them talk about weeks and months to much longer than that. Obviously implicit in that is the fact that they are already looking at models. And what the Prime Minister seems to be saying is, we want to give you a better picture than the data that we have already been using. We want to give you a fuller picture. They've talked about the importance of aligning the statistical information from one province to the next. It starts to get a little bit technical, I think, in terms of how they measure everything from the way people are being tested to all sorts of other aspects of this. But they are already looking at information. They're just waiting till they've achieved, I guess, a certain bar before they make it public to Canadians. But then that brings forward all kinds of other questions. When we get a sense of what sort of range they're looking at, how many waves they're seeing, for instance, in this projection, what does that say about the economic measures that they have to put in place to try to keep the Canadian economy? I'm not even sure that functioning is quite the right word, but in order to make sure that Canadians can pay their bills and put food on their table. Certainly also questions about the self-isolation measures that we're dealing with right now. I mean, I think that is for a lot of Canadians the most pressing question. If you're looking at data, if you're looking at projections, can you give us some sense of how long you might be asking us to stay home? Is there a moment where things might sort of the measures might loosen somewhat, even if we're talking about additional waves? So all of those questions that the government is going to have to deal with when it puts this data forward, and I think it's going to continue to be faced with these kinds of questions until it does.
It sure will. Okay, Catherine, I'll leave it there for a second. The CBC's Catherine Cullen. I want to swing over to Washington, where Katie Simpson is standing by. Katie, the Prime Minister got a lot of questions on President Trump and the order to stop sending masks to Canada. No concrete information from the Prime Minister about how many masks that means Canada is missing out on. Clearly, it's significant. I will point out very quickly before I just get you to jump in on what's happening in Washington with President Trump, that the Prime Minister did say in the next 48 hours, Canada will be receiving a shipment of millions of masks by a chartered cargo flight. He said we're also working with provinces to transport medical supplies when possible. Items ordered by Quebec, and we know from Premier Legault that Quebec is in dire need, 8 days until they run out of some of this PPE. Items ordered by Quebec will be on the flight. Katie, what are you hearing about the efforts behind the scenes? The Prime Minister says he's got a call with President Trump in the coming days. What are you hearing about efforts behind the scenes to try and get the president to change his mind?
Well, right now, the Canadian government is trying to take the same approach it took to NAFTA to try and resolve this very urgent dispute. And they're trying to lean on those key relationships that they established over the past 4 years to try and make Canada's case. President Donald Trump was very blunt in his words yesterday, seeming that he did not care that Canada was pushing back against this issue with 3M. But two senior sources with direct knowledge of the situation tell me that the Prime Minister's Chief of Staff, Katie Telford, is really trying to lean into the relationship she's developed with Jared Kushner, the president's son-in-law and special advisor, who now does have a key role on the coronavirus task force out of the White House. Down here in Washington, that is a source of huge criticism because Kushner does not have any experience in public health policy. He does not have any experience when it comes to military operations, yet he's been given a role to help with the marshaling of resources down here in the U.S. And he's already been criticized about the way the operations are going. He says the president called him because the president got a phone call from friends of his in New York, and his friends were hearing that they were running out of N95 masks. So Jared Kushner was told right away, get masks to New York City. And he said he got 200,000 on the way right away. So there's been a lot of criticism about how official channels down here are not being used in the way they should be in an emergency. However, according to one senior source, the Canadians see the Jared Kushner placement on this coronavirus task force as something that Canada can use to its advantage because Katie Telford has developed that relationship. During NAFTA negotiations, members of the Prime Minister's office were all assigned different members of the Trump administration to get to know them, to develop those relationships so that as negotiations became tense and as Canada kept trying to make its case on those talks, that they could reach out to those individuals and really sort of lean in to try and really make a case. That is the strategy that is being used here again. And two sources tell me that the Kushner connection is something that the Canadians are going to try and rely on. Now, I'm also told by one senior source with direct knowledge of the situation is that the key figures, the key points of contact right now are the new ambassador, Kirsten Hillman, who was just named ambassador about a week ago. She still has to go through some formal ceremony stuff, but she's in that role permanently. And Deputy Prime Minister Chrystia Freeland. They are the main channels of conversation at this point. But what I'm also told by this senior source is that because this is about the health and safety of Canadians, they're trying to employ all of the key relationships that they developed during NAFTA negotiations. And that's the strategy that they're going to try to use going forward.
Excellent. Thanks, Katie. Appreciate those details very much. The CBC's Katie Simpson for us in Washington. Thanks. You'll see on the corner of your screen, we are awaiting any minute an update from federal public health officials on the spread of the virus in this country. Before we get there, though, I think we have a few minutes to get to Drew Dilkens. He's, of course, the mayor of Windsor, Ontario. Hi, Mayor Dilkens. Nice to see you. Thanks for your time today.
Hi, Vashi.
So we just heard the Prime Minister talk at length. I get a lot of questions about this order from the President to stop sending masks to Canada. You are the mayor of a city that is so intertwined with its sister city on the other side of the border. We heard the Prime Minister also speak about the number of nurses, for example, healthcare workers that live in Windsor and work in Detroit. What can you tell us about how, I guess, interdependent that relationship is?
Well, Vashi, Trump's behavior here is not dissimilar to all those people who are hoarding toilet paper. It just has the power to be much more dangerous and much more deadly. And my city, certainly the 2,000 to 3,000 people that cross to work every day, healthcare professionals who live in Canada, cross that U.S. border every day to keep Detroit hospitals going. If there's some sort of hard stop at the border, if there's some sort of further restriction that the president is inching towards, I am telling you, without
sorry, Mayor
underestimating...
Dilkens, I got to interrupt you for a second. We're just coming off the main network. Give me 5 seconds. We'll be back on CBC News Network in just a second. Thanks for joining us. Hi there, I'm Vashi Kapelos in Ottawa. We're standing by waiting to hear from public health authorities in this country on the spread of coronavirus. I just rudely cut off Windsor's Mayor Drew Dilkens. Hi, Mayor Dilkens. Thanks so much for sticking around for that. I apologize. We just had to get off the main network and head back to CBC News Network. You were telling me a bit about how interdependent Windsor and Detroit is and how you view this decision from President Trump.
Yeah, I just, Vashi, without underestimating or understating the situation, if the president is inching towards a harder stop at the border and more restrictions, whether it's in goods or people, I'm telling you, on the human capital side, there are 2,000 to 3,000 nurses that cross the border who live in my city, cross the border into the United States every day to work at Detroit healthcare facilities. If there's some sort of further restriction, if this relationship becomes more difficult because of a what I would classify as an inhumane type decision, certainly an immoral decision, you will have hospitals, entire hospitals in Detroit that have to close down. And that is not an understatement because of the number of people that work and live in Canada, Canadians crossing to work in Detroit.
Have you heard anything, Mayor, from your counterpart in Detroit about this?
Yeah, I have spoken to Mayor Duggan on the Detroit side. I've spoken to several of the CEOs of hospitals there as well. And we all have a great relationship, and we talk and we understand the importance of the relationship here between the U.S. and Canada, and how, a state like Michigan, which is normally a Democratic state but voted Republican, voted for the president last year, what the impact would be if he actually puts a hard stop at the border and makes life more difficult. You could potentially have entire hospitals that close down. And the city of Detroit is a recorded hotspot for COVID-19 today. There's a 3-week shutdown, stay in place ordered by the governor. It is a hotspot for COVID-19 in the U.S. And so the game that's being played is deadly and dangerous. And our prime minister should certainly, in the comments that I just listened to, showing great restraint and great leadership at a very important time.
Yeah, I wanted to check in just on what the Prime Minister said. He said he would be talking to President Trump about this in the coming days. No specific timeline on that other than the coming days. He also reiterated, though, and Katie Simpson also talked about how the Team Canada approach, the one that worked in the NAFTA negotiations, would be applied here. What did you think of the remarks that you heard from the Prime Minister on this issue?
The Prime Minister is being very diplomatic and very appropriate. Putting troops on the northern border between Canada and the United States just a week ago was suggesting that he was going to open up the country again by Easter to be back in business at a time when things were spiraling out of control in several states. And now we're suggesting that, we're going to hoard, much like, people are hoarding toilet paper. This decision by the president, this behavior certainly just stands to play a much more deadly and dangerous game. It is immoral and it's inhumane. And frankly, you know what? I'm glad to see the Prime Minister saying that he's going to continue to make sure that Canada does what's right in the circumstances and make sure that we don't show and demonstrate that same type of behavior that we're getting.
Okay, I'll leave it there. I see Dr. Tam up to the podium. Thank you very much, Mayor Dilkens. Appreciate your time this morning. And let's head over right here in Ottawa to Dr. Teresa Tam, Chief Public Health Officer of Canada. Let's take a listen.
Provinces report them. I just want to point out, though, that we must take this illness very seriously. While the vast majority of deaths occurring in people in the older age groups, definitely the vast majority over the age of 70, we have had reports now, a number of reports of younger adults in their 20s and 30s who have died as a result of COVID-19, and others are seriously ill, hospitalized. So I think that's a very key message that we all have to take to heart really seriously. So we are continuing to test at a high rate in Canada, with tests completed now for over 309,000 people in Canada. So around 4% of people tested have been confirmed as positive and 95% confirmed as negative. And every day we are working with provinces and territories to increase laboratory capacity to make sure that we can maintain this level of testing and sensitivity in our testing systems to track COVID-19. Today, the Public Health Agency in Canada has released a new COVID-19 dashboard, and you can find that on our website. And of course, we have been releasing a lot of data and epidemiologic data. This dashboard then aims to make the data we have presented in a different way so Canadians can quickly learn more about how this outbreak is evolving and search for specific information. So this is the first time that authoritative Canadian data has been integrated into an interactive and customized dashboard. I know that I speak for all chief medical officers across the country when I say that we are very, very grateful for the efforts of all of those who are working in public health, in healthcare, in our laboratories to find cases, trace contacts, and interrupt transmission to slow the spread of COVID-19. Likewise, our thanks goes to all Canadians who are doing their part by changing behaviors, observing physical distancing, and disrupting plans to take on this national challenge to plank the curve. We must keep this momentum up as we wait for the signals that will tell us our efforts are working. The only way to get through this is together. So Canada, let's do all we can to stop the spread of COVID-19 together right now.
Bonjour. Comme d'habitude, on commencera par faire le point sur le nombre de cas de COVID-19 au Canada. On dénombre actuellement 12 924 cas de COVID-19.
There are 12,924 cases of COVID-19, including 214 deaths. Now, obviously, most cases have to do with older people, but we have also seen young adults affected by COVID-19 in their 20s and their 30s, and that's why it is so important that all Canadians take this very seriously. These represent infections from previous exposures and not what is happening right now. So even if you're not hearing of cases in your community, it doesn't mean that there is no risk of exposure. We must all consider that there could be community spread in our area, and keeping to our 2-meter distance is the safest option. We continue to test at a high rate in Canada, with tests completed for over 309,000 people in Canada. Around 4% of these people have been confirmed as positive, and 95% confirmed as negative. Every day, we are working with provinces and territories to increase laboratory capacity to make sure we maintain this level of sensitivity in tracking COVID-19 activity. Today, the Public Health Agency of Canada released the COVID-19 situational dashboard for Canada. This dashboard aims to make the data we have more accessible, so Canadians can quickly learn more about how the outbreak is evolving and search for specific information. This is the first time authoritative Canadian data has been integrated into an interactive and customized dashboard. I know I speak for chief medical officers across the country when I say that we are grateful for the efforts of all those who work in public health, healthcare, and laboratories to find cases, trace contacts, and interrupt transmission to slow the spread of COVID-19. Likewise, our thanks go out to Canadians who are doing their part by changing behaviors, observing physical distancing, and disrupting plans to take on this national challenge to plank the curve. We must keep this momentum as we wait for the signals that will tell us our efforts are working. The only way to get through this is together. Canada, let's do all we can to stop the spread of COVID-19 right now. Thank you.
We'll now start the question period. Nous commençons maintenant la période de questions. Pour les questions dans la salle, s'il vous plaît, utilisez le microphone sur le plancher. For questions in the room, please use the floor mic. We'll start on the phone. Operator.
Thank you, merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. There will be a brief pause while the participants register for questions. Il y aura un court délai vous permettant de vous enregistrer dans la file d'attente pour la période de questions. Thank you very very much for your patience. Merci de patienter. The first question is from Teresa Wright from the Canadian Press. Please go ahead.
Good morning, Dr. Tam. I'm wondering, when you talked about ramping up testing across in the different provinces, I'm wondering what kind of capacity we have to continue to ramp up the number of tests that are being done in terms of personnel trained to do this kind of work.
I think in the Canadian context, there's already a pre-existing network of public health laboratory, hospital labs, and others. So the way that we're looking at ramping up laboratory testing, there are many different streams. First of all, the current test that we're doing is a PCR test that detects the RNA, the genetic component of the virus itself. And what we're trying to do is to set up and support different provinces to set up more what we call high throughput testing, so that you can do more samples faster, and different jurisdictions are actually doing that as well. And so, and secondly, looking at what we call rapid tests that can be done not in high volume, but is very useful if you were living in more remote areas where transportation to the nearest lab is more difficult. So those are undergoing evaluation right now. And those tests can be easily trained, and different clinics or even in the territories, they're used to some of these technologies already, and they will be easy to use. And so training would not be difficult from that respect. Of course, we're always looking at new ways of doing things, aware of that internationally there are different lab alternatives that are coming up, but these need to be evaluated before we can sort of implement them. But another aspect, of course, which we will look at and is evaluating is, in the end, looking at the antibodies in people's blood and looking at immunity. So all of this is actually ongoing. And I think, as I've said in the last couple of days, Canada is one of the sort of highest per capita testing countries in the world. But we do need to look at an understanding on who we're testing, and making sure we're targeting the test to the populations at the right people at the right time as well. So that needs to be fine-tuned, I think, over time, depending on the epidemiology on the ground. So it is a slightly complex situation, but we're doing everything we can to up our capacity.
Thank you. One follow-up.
And just yesterday, on the projections that were released by Ontario, there were some fairly stark projections when looking at the number of the potential deaths in that province. How consistent are those numbers with projections that you have seen nationally?
So, first of all, I think for sure, I would like people to focus on what is actually happening to the outbreak right now. And I've just said that, we have this dashboard that describes the actual epidemiology, and we need to further understand the details of that epidemiology in Canada right now. So then the use of modeling or other projections, they always describe a range of possibilities. And these possibilities are for planning purposes. They're not actual crystal balls or real numbers. These, depending on the model, they're mathematical functions, etc. And you can sort of flexibly change those parameters. And so we use them as flexible tools. And so different jurisdictions can have different parameters as well. But we do work collaborative together with all the modelers across the country to look at those range of possibilities. But the bottom line, though, is that these possibilities are highly sensitive to our actions. So as we've said, any actions that we take now changes those range of possibilities considerably. It is important for provinces to input their situation because of these actions that are happening right now. and the experience are a bit different in different jurisdictions depending on the epidemiology. So really, just to reiterate that any range of those modeling and projections are highly sensitive actions, and that's why we keep saying we need to act now and practice social distancing, self-isolation, hand hygiene, and all those measures, because the fate of those possibilities or scenarios are in our hands.
Thank you, Doctor. Operator, prochaine question.
Thank you, merci. La question suivante est de Mélanie Marquis.
Mélanie Marquis, question from La Presse. You have the floor.
Dr. Tam,
Thank you.
I was listening to you, and it begs, to me, it begs the question: do you think it's a good idea to release these projections, these numbers? Are you comfortable with the idea?
That's an extremely good question. I think we all want to bring Canadians along to an understanding of how we're planning for different scenarios. But I think that it is our responsibility to ensure that the public actually understands what models are for and what they're about. And so I think with any of us who are looking at releasing some of these projections in the coming days, it is very important for us to explain these as well as we can, so that people do not think that this is what's going to happen tomorrow. These are not the crystal balls. These are scenarios for looking forward to planning purposes, and they need to be adjusted according to some of the real-time information that we have. So I think it's a responsibility that I think we need to all take very seriously, those of us who are releasing that kind of data.
So just to follow up, is that more a yes or a no? And as a real follow-up, though, with regards to the U.S. Putting a stop to exporting masks, 3M masks, how big does an impact does it have on our supply? To your knowledge, were we counting on 50% of these masks, these shipments coming from the U.S.? Is it 50%, 60%, 10%? Can you just give me a ballpark figure, please?
Yeah, just to finish off your first question then, that scenarios that's what they are. And I think it's reasonable to plan on worst case scenarios and look at where they take you. But it's also reasonable to look at what's happening right now and look at the sort of near term for planning purposes as well. So both the longer term and the near term planning for a range of scenarios is a practice that we do, and it is a useful practice. So in terms of the second question, I know that I'm probably not the best person to look at all the moving parts and the logistics, but we can certainly get back to everyone. But I think just to stress that the global supply of personal protective equipment is, there's a lot of stress related to that system. Everybody's looking at PPE. So we're pulling out all stops. I'm sure numbers in every stream of those purchasing or acquisition lines will change every day in a very dynamic manner. So as to what proportion this particular shipment or source, that will, I am absolutely certain, changes in a very dynamic way.
Thank you. One more question on the phone, and then we'll go to the room. Une question au téléphone, puis maintenant, nous irons dans la salle. Merci, opérateur.
Merci, thank you. The next question is from Marika Walsh from the Globe and Mail. Your line is now open. Please go ahead.
Hi, thank you, Dr. Tam. I'm wondering if you can say specifically if what we saw released from Ontario is representative of what the models show across Canada, or if it's an outlier, and if it is an outlier, whether it's an outlier on the low side or the high side.
I don't think it's an outlier. It is a range of scenarios. So I think, looking at different attack rates and different impacts, I think is definitely a very reasonable approach. We do input, of course, collectively the range of serious illnesses, for example, and deaths in a real-time basis as well. But those parameters actually change quite a bit with time. So I think all modelers or jurisdictions releasing data right now knows that those parameters will change.
And as a follow-up, on the U.S. ban on exports of medical supplies to Canada, what impact does that have on our already dwindling supplies?
I can't answer that specific question in terms of the U.S. piece, because I think that is still being worked out, and I think I will leave that to our ministers. But we are looking at multiple streams of supply, domestic as well as international over time. So that's again, a very much a dynamic situation. But what I would stress is that we have worked with the provinces and territories to look at providing them, it's a collective decision to look at allocation as well, and how we do that in a sort of real-time basis.
Thank you. Let's start in the room. CTV.
Mackenzie Gray, CTV. Dr. Tam, we've asked you a number of questions about masks. You've outlined why you think people touch their face more, why they might not necessarily be effective if they're not used right. Yesterday, the CDC in the U.S. put out a voluntary guideline saying that if people are going outside, grocery store, pharmacy, that they should wear masks. So is Canada changing their guidance so people should wear masks outside?
I recall your question a few days ago, and then I think I've answered this question a few times in the ensuing days, and that's how fast science might be evolving. So as I've said, that we're still learning about this virus that's only been with us really since January. And we, like the United States, is looking at the latest information and looking at recommendations right now. So as I've said in the last time I was at this briefing, and certainly we'll be looking at the guidance in many different guidance, actually, not just whether people should be wearing masks in public. From the public wearing of masks perspective, our key message is that we need to reserve medical masks for healthcare workers. And we just talked about the fact that, some of these personal protective equipment is in sort of scarce supply situation, and we need to prioritize people who are looking after the sick. And then I would say my next strong message is that there are things that do work that we need to continue to do. And that includes the physical distancing, staying home if you're sick, hand hygiene, etc. So then one of our recommendations for things that people should do is cover your cough and not spread things to others by practicing cough etiquette. What we are looking at in terms of the new science is whether people who are just before they get sick transmit. So that's a very important piece of science which is coming out right now. And if that's the case, having some covering protects you, it prevents you from transmitting your droplets to others. So it does act as an additional barrier on top of all the other things that we're recommending. So I think that what we're saying is that if people use coverings that are homemade or otherwise, not the medical masks, then we will provide information on how you would do that properly.
One follow-up.
So I just want to be super clear. It's the weekend. A lot of people are going to go out and get groceries, go to the pharmacy. If I'm leaving my house after this press conference listening to you, should I fashion some kind of mask? Should I have something on my face to be covered up?
Well, I think depending on the situation as well as whether you can do social distancing. I think that's one thing you can evaluate. For example, if you're in public transit and you cannot easily practice the 2 meters, for example, then having that additional covering, like covering up your cough, I think is a good idea. So it depends on what activity. So if you can maintain that 2-meter distance, then that is what you should do. But I think having an additional covering and a barrier to prevent you from spreading droplets to others, I think that is a reasonable thing to do. But by the way, we are actually reviewing the science right now, so we'll have more recommendations in the coming days.
Thank you. Dr. Ashley, CBC.
Dr. Ashley, that sounds good. Ashley Burke, CBC News. What essential medical supplies beside N95s does Canada get from the U.S. that are needed for this pandemic?
I'm going to have to get back to you on that. So I know that we have a range of different supplies that includes a whole range of medical equipment and some laboratory supplies. So I think I am not the lead on the logistics and other supplies, so I think we're going to have to get back to you on that.
The U.S. is seeing a shortage of drugs used to treat COVID-19. If the U.S., this executive order happens to impact that and medications coming across the border, could that create a shortage here in Canada? And what are your concerns?
Well, I think there's two aspects to this. One is that there's currently no proven treatment for COVID-19, but we do have clinical trial sites. And so making sure that those trials are enabled is very important, and getting supplies for that. So it is definitely something that we are working on. But Health Canada actually is monitoring the supplies of all essential medicines and drugs as well very, very closely. And so if there's any signs that certain medications are important for Canadians, it is impacted, then specific actions will be taken to look at how we can get that supply from the original source or from other sources.
Thank you. Radio-Canada.
Question, Radio-Canada.
Bonjour, Christian Noël de Radio-Canada.
Christian Noël, Radio-Canada. My first question is about the chartered flight from China that the Prime Minister referred to this morning. How many masks and what kind of masks are being shipped to Canada? How much did it cost? And to which provinces are these masks going? And when will they arrive? Easy questions, I would say. Answer. Thank you for the question. As Dr. Tam said, we work at a technical level with our counterparts in public health in all provinces and territories. With respect to the logistics, which is a very current issue, it's a situation that's constantly evolving, and we're not necessarily involved in the ongoing discussions regarding flights and the quantities involved of personal protective equipment. Others do that, but we can always come back to you with numbers. Currently, we do not have those numbers. Follow-up. Then perhaps I can reformulate that question. How much do we need that equipment? Answer. Well, we always need PPE, and we need it now. It's an ongoing issue. We know we're dealing with a global market. There is a lot of competition in terms of obtaining this critical equipment. The federal government is working very closely with the provinces, and obviously it's a good thing for Canada to get bulk orders, and we also use a formula to distribute and allocate this equipment to the provinces, but that really is the way Team Canada works.
English, if I may, on the number of ICU's beds that we might need, Ontario had a projection of what they have. Do we know right now in Canada how many ICU beds are available? How many ICU beds we could raise the limit to? And is that going to be enough if we hit high peak?
So the provinces and territories are most in tune with the exact ICU capacity availability on any given moment. But what I will be able to tell you is that the number of cases, the serious cases that we have, is far within the capacity of Canada to cope with the outbreak right now. What you're seeing provinces doing with these projections, etc., are actually to plan for a much worse case scenario. So they are planning for that. They have essentially cancel elective surgeries, etc., so that there's actually a excess of beds available right now. So in some jurisdictions, they are at about 50% of the ICU capacity, but it is a very dynamic situation that the provinces can address. At the national level, we can only sort of look at in very crude ways the total number of ICU beds in Canada, and then I can look at the numbers who are maybe in ICU, and I know that Canada has a much bigger capacity for ICU beds than the number of cases right now. But that could change, which is why we want Canadians to do everything that we can to reduce that health impact and reduce the impact on our hospitals.
Maybe if I could just add to that, I think it's hypothetical in terms of the number of ICU beds and even ventilators that we may need. And so I think nothing's cast in stone. And that, I think what we're trying to say to all Canadians is that you have to do your part. Because if we're trying to flatten the curve, it's all about not exceeding, as you say, maybe in this case, ICU capacity. So given the transmission and propagation du virus, what we're saying is that, okay, hypothetically, over time, there may be 1,000 people in a given area that might need ICU care and ventilators. There's a difference if those 1,000 people end up in the hospital in the same week as opposed to being spread out over several weeks and months. So that's what we're talking about, flattening the curve, slowing down the transmission of the virus, so that in the worst or best case scenario, those 1,000 people will be spread out and won't exceed the healthcare capacity. So that's what we're looking at. And certainly Dr. Tam and myself, we're working with our counterparts, and we're looking at how best to increase the capacity so that we do have that surge capacity. The fact that the hospitals across Canada are delaying or stopping elective surgery, pulling in retired physicians, are all sorts of things that we're doing to basically make sure that Canadians do have access to the care they need. Thank you.
Let's go on the phone now. Maintenant, téléphone opérateur.
Thank you, merci. La question suivante est de Catherine Lévesque, La Presse canadienne. Votre ligne est ouverte.
Question, La Presse canadienne. Good afternoon. I'd like to come back to the issue of masks. Mr. New, are you saying that you have no idea how many masks we'll be receiving and how that will be allocated and the kind of masks that we'll be receiving? Answer. As I said, we know that this is a very fluid situation. Everyone, including the federal government and the provinces, are all on the same page. We are doing the best we can to obtain the masks that we need. We need these medical masks and personal protective equipment. There is a global supply of this equipment, but this represents a challenge. We know, we've seen what's happening in the United States and in other countries. It's a global challenge. We're doing the best that we can. Now, at the same time, we have also said that we're working closely with industry in Canada, because at some point in time, not necessarily now, perhaps in a few weeks or a few months, we are going to have the capacity to manufacture essential equipment here. But for now, the situation is constantly changing, and I can't give you exact numbers. Follow-up?
I was going to just repeat in English, saying that, yes, in terms of Dr. Tam, myself, others, we're working obviously very closely with our counterparts in the provinces and territories. As all of you know, the situation with personal protective equipment and N95 masks is a very live situation. It's fluid. The global market is very competitive. We know what other countries are doing. We've heard what's happening in the United States. We're doing our best efforts, and that's not just the federal government. It's working in concert with the provinces and territories to get the necessary equipment we need for our frontline healthcare workers. So that's priority number one, and we're pulling at all the stops, as they say. The other part, though, and this is not something that's going to happen today, but hopefully, in several weeks, months, is that we're also ramping up and looking at our domestic capacity. Because down the road, what we hope to do, obviously, is have domestic capacity to manufacture and make the type of essential medical equipment here in Canada, so we don't have to, quote, rely on the sort of the global market. So that's something that we're looking at in the long term. But for the moment, it's difficult to give you exact numbers because the situation is so dynamic and fluid. Thank you.
Thank you, Dr. New. Catherine, question suivie?
Follow up, Catherine?
Oui, absolument. Donc on en comprend que en
Thank you.
attendant
So while we're waiting to be self-sufficient in a few weeks or a few months, and given that we can't necessarily depend on the United States, which countries do you think we can request this equipment from? Will we have to rely on China, or are there other countries that will be able to supply the material that we need? Answer. Well, I don't think I'm necessarily in a position to comment on what's happening with the United States. The Prime Minister has said this is an ongoing issue. It's not that the market is closed. The Prime Minister and all other premiers and leaders are having very productive conversations with their counterparts in the United States in order to ensure that the flow of goods and services continues and continues to cross our border with the United States in both directions. Now, at a technical level, as well as at a political level, we are always ready to engage in conversations with countries throughout the world. We're doing the best we can with all and any countries, potentially, any country that may be a potential source of essential medical equipment for Canada.
Let's go back in the room. Mackenzie?
Maybe either one of you can answer this. You've mentioned, Dr. Tam, specifically about religious holidays and holidays coming up. Easter's a week away. If, let's say my mom calls me up and says, Mac, you're going to come over for dinner. What example and what advice would you give to Canadians right now who would traditionally be gathering in big groups for Easter? Is Easter canceled? Should we be having people over? What's your advice?
So we're advising, and I did communicate with religious leaders as well to gain their support to help maintain physical distancing while also continuing the connections that you need, social connections. So we are encouraging people to connect in a more virtual way. I think that's one of the key aspects. But our recommendation is no non-essential gatherings, and most provinces have very key recommendations on gatherings, and they're anything less than 5 to 15. But again, even a small gathering is a matter of maintaining that social distance and the sort of hygienic practices.
I can just add a personal sort of note. Yes, we are planning for Easter in my family. My 2 boys are in Montreal, in Quebec, and we also have family on the other side of the river. So we're planning a virtual Easter. I can tell you that right now. We're going to try and figure out the timing. We're going to set up our little sort of webcam or whatever, and then we're going to toast each other and celebrate virtually. So that's my personal situation.
Dr. Tam, on testing, I just want to clarify something that journalists have asked a number of times. I went on the Ottawa Public Health website and I took a look at the people who are qualified to be able to get a test right now if you're showing symptoms. One group that's missing is people who are non-essential workers who've not traveled but are showing symptoms. Previously, when we've asked these questions about why people who are showing symptoms but don't have the previous history of travel, the response you've basically given us is that the priority has gone to travelers. It's been about 2 weeks now since Canada's closed its borders. The number of travelers coming back is very limited. Are you considering changing the guidelines to expand testing to allow people who don't have a travel history, who aren't essential workers, but are showing symptoms to be tested?
So the key recommendation for people with mild symptoms is to stay home. And you can also use some of the apps that are on different websites, certainly on coronavirus.ca, where you can self-assess to determine if you should seek further attention from public health or from medical advice. So hopefully that will help people decide whether they need to present or not for further testing. So your question is an important one in that if you looked at the sensitivity rate of our lab testing, over 95% of the tests that we run are on people who don't have the virus. So we are testing a lot of people who actually don't have the virus, and I think that's actually very reasonable for communities that are trying to detect if they have community transmission or not. And so, and that can be also done in different ways in terms of a surveillance system. But I still think that if your objective is to detect if the virus is in your community and if there's any community transmission, it is still really important to test the people who are severely ill, hospitalized, and then the people who, like health workers and those very specific situations. What we're asking all Canadians to do who are symptomatic is to stay home. So that test itself doesn't change that recommendation. So I think that's the other way of looking at it. Will that test change what happens to you in terms of your health management? And right now it would not. So everyone who is even mildly sick should be staying at home and definitely distancing themselves from others.
I think we're running short on time. On commence à avoir un manque de temps. Ashley, last question.
Can I just finish one thing is that I will be talking about some of our efforts and looking at the antibody tests in the coming days. So that's later on if you want to detect the level of immunity in the population because people hadn't been tested, they've just all been staying home. That's a different kind of study. So it's a sort of layered approach to determine what exactly is happening with that outbreak in our communities.
Can you tell us a little bit about the stockpile of medicine that we have? I know there isn't a treatment for COVID-19, but there are things like antibiotics, antivirals, things for pain management that are being used. Can you tell us about the stockpile and if we do have enough in Canada here alone right now to treat people?
So I think supply of medication is something that has to be monitored in real time. And I think at the federal level, Health Canada coordinates and requests manufacturers to tell them if things are in short supply. So these are the regular systems that we have. At the different sort of levels of government and people who look after the actual health systems have those supplies. So I think at the federal level, we will have to help detect signals and find everything that we can to get those supplies in. There's many mechanisms in terms from the regulatory perspective in getting medicine. Some of them may not even be licensed in Canada, but can be coming through emergency use. At the federal level, I just want to be very clear that our stockpile is a very, very specific one that is targeted towards some very unusual pathogens like smallpox or Ebola. It is the provincial jurisdictions that have maintained those supplies of regular medications and in our sort of pharmaceutical system. So I just don't want people to get the wrong impression that the national emergency strategic stockpile is where their medicines are. But we do have a very key role in monitoring all of those things that Canadians need. And many other departments can also help in making sure that we have what we need.
You're in constant communication with the provinces and territories and their medical officers of health there. Have any of them flagged to you that they could be facing a shortage of these types of medicines?
I think that's a question that Health Canada might be better to answer. But so far, I think people are flagging certain medications like asthma medications and others where we have to keep a close eye on supply.
Merci, c'est ce qui met fin à la conférence de presse.
Thank you. That ends the press conference.
We've been listening to Dr. Theresa Tam and Dr. Howard Nuge, the top public health officials in this country, address a number of questions, the bulk of which focus on what has become actually a very political issue, and that is the supply of personal protective equipment, essential medical supplies for healthcare workers in this country, the kind of stuff that they need to treat patients who are suffering from COVID-19. In particular, those questions focused on N95 masks. Those are the masks that those healthcare workers wear. They keep out about 95% of the particles that could contribute to the spread of the virus. Last night, President Donald Trump, south of the border, issued an executive order that effectively tries to block the export of those masks from a company called 3M. They supply a significant amount of masks. We could not find out from that press conference, although the public health officials and the Prime Minister were all asked frequently how many masks exactly Canada gets from 3M, how big a supply it is compared to our other places that we source those masks. However, we have heard politicians often use, and those public health officials say, that it is a significant portion of the supply. We just don't have the exact number. I want to get some analysis right away on where this is all headed, and for that I'm joined now by Sarah Goldfeder. She's principal at Earnscliffe Strategy Group. She's with us from Ottawa. Also, again with us, Scotty Greenwood of the Canadian American Business Council. She joins us from Washington. Hi, Sarah. Hi, Scotty. Good to see you both.
Hello. Hey, Vashi. Hey, Sarah.
Sarah, I'm going to start with you. You've been helping me behind the scenes really understand sort of the genesis of what the president has ordered. Can you help our viewers understand as well exactly what the president is dictating right now?
Sure. So the Defense Protection Act is an act that the president enacted a while back to help domestic production of key items that would be needed in the response to this crisis. And so it's a wartime piece of legislation that was really constructed to ensure that the United States had everything the United States needed in the case of a war, which is what this is being presented as quite frequently in the evening briefings by the White House. He's called himself a wartime president. He clearly sees this as a wartime response, which is why he's using a no-holds-barred attempt to get all of the gear and all of the different pieces of equipment and medicines that the United States needs in order to help its citizens. It's not unheard of. It's not the only country that's kind of taken these same kind of steps. The EU has done this as well. China has done this as well. Taiwan, Japan, Korea, all did similar actions to try and push back against the loss of resources at the peak of the epidemic in their countries. And so this is part of that attempt by the United States. So what it does is it requires all American companies that are operating in the United States, if they're producing items that are deemed critical to this response, it requires them to fill federal orders first.
Scotty, the message from the Prime Minister, and even we had Windsor's Mayor Drew Dilkens on, seemed to be, and I'm paraphrasing here, but Sarah's exactly right. All those other countries are doing that. I think the message they're trying to send is Canada isn't all those other countries. And we heard Mayor Dilkens, for example, go over in great detail the interdependence of the healthcare communities on both sides of the border, that there are upwards of 2,000 nurses, for example, who live in Windsor, who work in healthcare facilities in Detroit. How effective might that message be when the Prime Minister is talking to the President, he says, in the coming days?
Well, it has the benefit of being true. So the economic interdependence, the lives of our countries are really intertwined. And what I would point to is I published something in Policy Options this past week that talks about not just the Defense Production Act, which Sarah quite rightly points to, the President has evoked, but there is a subsequent memorandum of understanding between Canada and the United States called the Canada-U.S. Defense Production Sharing Agreement, in which it says whatever we do, whatever the response is, we should approach it bilaterally. And I think that's really appropriate here. This crisis doesn't know boundaries, the solution or borders. The solution is not going to know a border between Canada and the United States. That whenever the vaccine comes, whenever the treatments come, it could easily be a Canadian lab, a U.S. lab, a lab somewhere else in the world. And we have to have patterns of working with each other, and we have to have trust between each other so that we can confront this together. And Vashi, you and I talked about the inputs for making certain of the personal protective equipment come from Canadian pulp and paper mills. So there are all sorts of reasons we need to work together on this and not turn inward.
Let me ask you, Sarah, to what degree do you think that message will resonate with the president? And I ask because, as you highlighted, every night he and other officials are coming out and conveying the idea that this is wartime. Like, the pressure on that administration to fulfill the needs of states when it comes to supply is immense right now.
Right. And so while I think, what Scotty brings up is 100% correct, it's really, really difficult to unscramble the egg here for the United States and Canada supply chains, especially as it pertains to some of this protective equipment. The reality is that the United States has acted in the United States' best interest before in ways that does not necessarily benefit Canada. We can think most recently to the 232 tariffs. And I think that there's been things that the president has done recently that I think show that he's definitely viewing this differently, I think, than necessarily a trade relationship or even the close bilateral relationship that the United States and Canada have. For example, the overture he made to CureVac on their production of a vaccine, which is a German company, and there is some precedent out there that around the world when the Australian medical company created the vaccine for H1N1, their own laws made it so that the Australian producers had to vaccinate Australians first. And so I think there is a fear that whatever happens next in this pandemic, that countries that come to solutions first will take care of their own people first, and only then will look outside their borders. We heard from the Prime Minister today that Canada understands that to some extent and is looking for domestic production and really is facilitating a lot of companies engaging in further domestic production of this PPE and the equipment that's going to be required here. And I think that that's wise, because I think despite the bilateral relationship, Canada needs to ensure that Canadians will be serviced and get all the equipment they need.
Scotty, I have just a minute left. Actually, I want to just touch on what we also heard from the Prime Minister and from my colleague Katie, in that Katie Telford, a very significant advisor to the Prime Minister, will lean on her connections, for example, with Jared Kushner. Is the behind-the-scenes Team Canada approach the right one?
Absolutely. Behind the scenes, in front of the scenes, around the scenes, everybody has to engage at every level. Canada knows how to do this. Canada's ambassador to the United States, Ambassador Hillman, knows a lot about how this has got to work. So I think that is incredibly good that she is here. But Katie Telford reaching out to Jared Kushner and others that she knows quite well from her career in public service will come in really handy, as will all of the other relationships between members of Parliament and members of Congress, members of the executive, governors, premiers. All of these things need to be brought to bear in order to get through this, and to remind the United States that even if we are on wartime footing, as we have been in the past, that the answer is, at least from a Canada-U.S. point of view, to confront the challenge together. And I think that message will resonate. I think it has to resonate.
Okay, I'll leave it there. Thank you very much to both of you. Wishing you both the best of health. Thanks to Sarah Goldfeder and Scotty Greenwood. And we want to get some more information on those masks, why they're so crucial for healthcare workers. For that, we're joined now by CBC medical correspondent and family physician, Dr. Peter Lynn. He's in Toronto. Hey, Dr. Lynn, good to see you again.
Hi, Vashi.
Help us understand the difference between N95 masks and, for example, surgical masks. These are the masks, the N95s, that the president is trying to block Canada from getting right now.
Right. So the N95 masks are fitted so that they're sealed around, and they actually do a special test where they put a bag over your head once you've got it fitted, and they put chemicals in there for you to smell. So if you can't smell the chemicals, then the mask is sealed and it's proper. So that will stop 95% of the viral particles. Very important for people that are right close to patients, for example, that have COVID-19, because there's a lot of viral particles that are sitting there. For the normal surgical masks that you always see people wearing, those ones are leaky. So those are helpful for in other situations, but the N95 is crucial for people that are looking after patients that have COVID-19. And right now we have about 500 plus patients in hospital situations that will require that kind of level of protection.
What about the supply of it? It's hard for us to ascertain exactly, because it depends on the province, how many of those masks really healthcare workers need. What do you hear from your colleagues about the potential for a shortage?
There is rationing already, and that's already happened before any of this situation happened with the Trump administration, because the hospitals were realizing that we can't afford to have all the masks being tossed away. Because most of the time in each situation, when you go from one patient to another patient, you have to get rid of everything. So that's why in the beginning they said we need to keep these masks so that you get 2 per shift, or they were limiting it only because they wanted to make sure that there was enough supply floating around. But learning from Italy, what they keep telling everybody is locate all the COVID-19 patients in one location. What they did was they actually pushed everybody into one hospital eventually. Like at first it was all over the place. So you might have a patient here, which now means that anybody that goes in that room has to gown and then disgown and get rid of everything. Whereas if you keep everybody together, then basically the doctors and the nurses and all the healthcare personnel can wear the same gown, the same mask, and look after many people at the same time. So let's say there's 10 people in one area, they could look after all 10 people. They don't have to keep changing things. And that way we could decrease the number of personal protective equipment that we go through. Whereas if you have one patient here, that becomes difficult. So the Italian experience is clump everybody together so that way you don't have to keep changing your personal equipment.
Okay, appreciate your expertise as always, Dr. Lin. Thanks so much for joining us.
Thanks, Vassie.
Dr. Peter Lin from Toronto. Once again, the news from the United States that President Trump will or is attempting to stop 3M from exporting N95 masks to this country. We were unable to find out from the Prime Minister exactly how many of those masks that means, but he does promise that other masks from China are on their way to this country. In fact, millions, he said, via a chartered flight, and there are more to come. He does insist that many of those masks are headed straight to Quebec. We know from the Premier of that province that the need there is immense. They might run out in the next 8 days, he says. That does it for our coverage. I'm Vashi Kapelos. Up next, Michael Serapio continues right here on CBC News Network. Stay with us.
Oh, so fancy. And a real towel. Those actually stay here. Oh, yeah.
Kim's Convenience. All episodes now streaming on CBC Gem.
For over 50 years, Nissan has brought Canadians together. But now, we need to help as we all learn about keeping a safe distance.